This program is for informational purposes only and should not be used as a substitute for individual medical attention. Always consult a qualified healthcare professional before undergoing any medical treatment.
When an infant or toddler's bowel can't remove waste because of disease, injury, or defect, a new opening, called an ostomy, is surgically created for stool or urine to leave the infant's body. In this program, you'll learn how to clean and change an ostomy pouch, and some tips for keeping the nearby skin free of irritation. The information applies to intestinal and urinary ostomies using one-piece or two-piece pouching systems and to all manufacturers' brands. Ostomy care is not difficult, but if you're new to the task, it can be challenging. Take heart. With practice, you'll be as confident and capable as the thousands of parents and caregivers just like you, caring for an infant's or toddler's ostomy. The most common ostomy is called a colostomy. Surgeons make an opening in the baby's abdomen and bring up a section of the large intestine, or colon. The end is folded back like a cuffed sleeve and sewn in place. The part you see on the outside is called the stoma. The infant's stool passes through the intestines, out the stoma, and into a pouch. Some infants with a colostomy have a second stoma, made from the lower, non-working end of the colon, called a mucus fistula. It drains mucus and gas but no stool. Usually, the mucus fistula is not pouched. An ileostomy passes stool from the ileum of the small intestine into a pouch. A vesicostomy drains urine from the bladder, sometimes into a pouch, but usually into a diaper. The different types of ostomies have similarities in how they're cared for and function, starting with the stoma. The stoma is the visible part of an ostomy. The normal stoma appears red and moist, like the tissue of your cheek or gums. It may stick out a bit, or it may be flat against the skin. After surgery, the stoma may be swollen, but it gradually will shrink over the coming weeks. As the baby grows, the stoma will grow. The stoma has no nerves, so the infant can't feel pain there. There is a rich blood supply, however, so it bleeds easily. Since the stoma usually is part of the intestines, you may observe peristalsis, the rhythmic contractions that move stool along in the bowel. The stoma has no cutoff valve, so there's no way to control when stool passes. The skin around the stoma, the peristomal skin, is sensitive to contact with stool. Keeping it free of irritation is one of your most important ostomy care goals. Sometimes stool is allowed to drain from the stoma directly into a diaper, but pouching controls odor, protects the sensitive peristomal skin, measures output, and costs less than diapers. The choice of pouch depends upon the infant's size, activity level, and type of ostomy. Discuss your options with an ostomy nurse. Empty the pouch when it's 1/3 to 1/2 full of stool or gas. An overfilled pouch is heavy. It tugs and loosens the adhesive, allowing stool to contact and irritate the skin, leading to baby discomfort. First, gather your supplies. You'll need cotton balls or a washcloth and a baggie. Lift up the pouch, remove the clamp, drain the stool into the baggie, or into the diaper. Wipe off the end to reduce odor. Close the pouch. Note the stool's consistency and color before disposing of the baggie in a waste can. An ileostomy is early in digestion, so its stool is watery and has digestive juices that can burn skin quickly if allowed to stay in contact. A colostomy, however, is farther along in digestion, so its stool tends to be thicker. If the stool appears bloody or has excess fluid or diarrhea, notify your healthcare professional. It's best to change an ostomy appliance and inspect the skin underneath on a routine, preset schedule, rather than waiting for a leak. The skin barrier adhesive can hold its seal from 1 to 4 days, depending on the baby's activity level and the stool's consistency. With experience, you'll determine the best schedule for your baby. Remember, a leak means stool is in contact with the sensitive peristomal skin, possibly causing irritation and discomfort. Never tape a leaky barrier, since that just traps stool under the barrier against the skin. Always change the pouch and inspect the skin on schedule or sooner if the pouch is leaky, smelly, or loose. A properly sealed appliance does not smell or leak. It's not easy for one person to change a squirming baby's ostomy appliance, so ask for help or wait for baby to settle down. Routine, scheduled pouching is easier when the stoma is inactive, such as before feeding, or when the baby is calm, such as after the evening bath. To change the pouch, first gather your supplies: a new pouch, baggie, paste, blunt-tip scissors, measuring pattern, marking pen, soft baby cloth, and warm tap water. Use caution when removing the barrier. Adult skin is strong and stretchy, but infant skin has a thin outer layer and a weak bond between the dermal and epidermal layers. Careless barrier removal can strip the skin. So, start at the top, hold the edge of the barrier, and use a moistened baby cloth to gently press the belly down and away from the barrier. Like this. A bit of redness right after you remove the skin barrier is okay, but it should fade quickly. Look at the stool's consistency, color, and quantity. Examine the barrier seal. Look for signs of undermining and breakdown, which could mean a leak is starting, and that stool may be touching and irritating the skin. The time between pouch changes may need to be shortened. If you see no signs of leakage and the skin appears healthy, the wear time is fine. Put the old pouch in the baggie and throw it away. Moisten a baby cloth with warm water and clean the skin around the stoma. Don't use soap, medicated wipes, or lotion, since their residue can prevent the new pouch from sticking properly. Clean the skin and stoma with water only. Inspect the peristomal skin. Keeping the peristomal skin free of irritation is an important ostomy care goal. Gently dab the stoma clean. Stomas don't hurt, but rubbing it may stimulate stool passage. The stoma may bleed a bit, which isn't a problem. The normal stoma should appear moist and beefy red. Measure the stoma with the pattern. Select the size that's within 1/8 of an inch of the stoma, but not touching the stoma. Sizing is important. If the opening is too large, stool can touch and irritate the tender skin and lead to early leakage. An opening cut too small might rub and irritate the stoma. A good fit means a longer wear time and less baby discomfort. Trace the correct opening on the paper backing. Carefully cut the opening. Smooth out the cut edge. Clamp or close the pouch. Warm the adhesive for a minute in your hands or under your arm to help it stick better. Check the skin to make sure it's completely dry. Peel off the backing and center the pouch over the stoma with the bag hanging to the side for easier emptying. Gentle circular pressure from the center out removes wrinkles, and the mild warmth helps set the adhesive against the skin. Write the date and time as a reminder for the next pouch change. The procedure is similar for a two-piece appliance. Measure and cut the barrier hole, then snap the pouch onto the barrier. Remove the adhesive backing from the barrier and center the barrier over the stoma. If the skin barrier goes on a divot, incision, or the belly button, ostomy paste can help get a good seal. Paste isn't glue. Paste is like caulk. It fills in problem areas that otherwise might leak under the skin barrier. Ask your ostomy specialist if paste will be helpful for your infant. Now, here are some Ostomy Care tips and some common problems to watch for. Always check with your doctor or nurse first to see what is right for your baby. It's okay to pick up and hold a baby with an ostomy. It's okay for the baby to crawl, to roll over on the pouch, and to put his weight on it during tummy time. Sleeping on the pouch won't hurt it, but follow the back-to-sleep recommendations of your pediatrician for infants less than 6 months old. At bath time, soap and water won't harm the stoma or get inside of it. The stoma can become active at any time, however, so it's best to keep a pouch on. After the bath, when the infant is calm, is a good time to make scheduled, routine pouch changes. The pouch can be worn inside or outside the diaper. Dress baby in a one-piece outfit so he can't play with the pouch. Explain the ostomy cleaning and changing procedure and show this video to other people who care for your infant, such as a relative, babysitter, or daycare provider. A common ostomy problem to watch for is peristomal skin irritation. This can have several causes, so consult your ostomy specialist. A persistent irritation like this often is caused by repeated stool contact. Your nurse may recommend an ostomy powder be applied to the peristomal skin at pouch changes, as well as more frequent changing of the skin barrier. Infant skin is very sensitive. Compared to adults, infants have 3 times the ratio of skin surface area to body weight. That means an infant's skin absorbs products more quickly and in greater concentration. Mechanical trauma can be caused by stripping off the skin barrier or by excessive cleaning of the skin. This is an allergic reaction of the toddler's skin to an ostomy product, in this case, the tape of a pouch. Sometimes a stoma can stick out more than usual from the infant's abdomen or appear bigger than usual. This is called prolapse, caused by an increase in abdominal pressure. Although not usually a medical emergency, it can be alarming, and you should notify your doctor. Caring for an infant or toddler with an ostomy can be challenging, but help is available. The main goals are for the pouch to stay on without leaking for at least 1 day, and for the skin around the stoma to remain free of irritation. If you're having trouble achieving these goals, or if you have any questions or concerns about your infant's ostomy, contact your ostomy nurse, surgeon's office, or other healthcare professional.